Did you know that back in 1800s, the average age when girls first have their menstruation is when they turn 16 or 17? Throughout these years, the average age where girls have their period have changed and mostly starts at the age of 12. According to scientists, this is because of improved nutrition. Compared to a few hundred years ago, we eat better and more frequently, and fat cells produce estrogen. Our body produces more estrogen when we have more fat cells, which can cause the beginning of the female menstrual cycle. Good day, everyone. I am Charisse Novabas, and the important thing I want to share with you today is about polycystic ovary syndrome. Polycystic ovary syndrome, or also known as PCOS or PCOS, is a health problem that affects how women's ovaries work. They might not have regular periods, make periods heavier, have periods that will last for many days, or perhaps they will make periods stop. A woman may occasionally produce insufficient amounts of the hormones required for ovulation. The ovaries may grow a large number of small cysts when ovulation does not happen. Most of us know that boys and girls produce hormones but in different amount. For girls, progesterone, estrogen, and androgens like testosterone are all produced by the ovaries. These hormones regulate a girl's menstrual cycle and ovulation. Girl with polycystic ovary syndrome or PCOS makes higher amounts of androgen that will interfere with egg in development and release. Instead of eggs maturing, it sometimes develops as cysts. The cysts then grow inside the ovaries during ovulation instead of an egg being released during a regular cycle. According to Better Health Channel, a cyst is an abnormal pocket of fluid, like blister, that can form in many different areas of the body, including the skin, genitals, and internal organs. Polycystic ovary syndrome or PCOS might be also caused of insulin resistance. Up to 70% of women with polycystic ovary syndrome cannot use insulin properly. The pancreas secretes the hormone insulin to support the body usage of sugar from foods for energy. The body requires more insulin when cells can properly use it. To make up for this, the pancreas produces extra insulin, which triggers ovaries to produce more male hormones. Obesity can also increase the insulin levels and make polycystic ovary syndrome symptoms worse. In addition, it may also run in families and are hereditary. Having a family history of PCOS or polycystic ovary syndrome may play a role in developing the condition. During late adolescence or the beginning of the 20s, polycystic ovarian syndrome signs and symptoms typically become noticeable. These include having difficulty in getting pregnant, having irregular periods or no periods at all, hirsutism or an excess hair growth in chest, stomach, back, face, or buttocks, dark or thick skin patches in the back of the neck, in the armpits, and under the breast, excess of skin in the neck and armpits, oily skin, hair on the scalp gets thinner or male pattern baldness. Furthermore, about 80% of women with PCOS are overweight or have obesity. They usually gain weight, especially around the abdomen, and have trouble losing weight. Women with polycystic ovary syndrome can develop serious health problems such as type 2 diabetes or prediabetes, gestational diabetes or diabetes when pregnant, heart disease, high blood pressure, high bad cholesterol, and low good cholesterol, which increases the risk of having heart disease. In addition, it can also develop sleep apnea, or a disorder which causes someone to stop breathing during a sleep, stroke, depression, endometrial cancer, anxiety, eating disorders, non-alcoholic steatohepatitis, which is a liver inflammation and damage caused by a buildup of fat in the liver, and infertility. A variety of factors affect how PCOS is treated: your age, the seriousness of your symptoms, and your general health. One of the treatments is lifestyle and modification, which is having a healthy diet and more physical activities. Diabetes medications, which decrease weight and improve insulin and cholesterol levels. Hormonal therapy, such as birth control pills, to help regulate the menstrual cycle and reduce male hormones. Moreover, it is also possible to have surgery and take medications to block androgen. Infertility is frequently brought on by polycystic ovary syndrome, which has been related to other illnesses as what I have mentioned. If you think you might have PCOS or observe that someone might have it, maybe a sister, mother, or a friend, advise them to discuss it to a healthcare professional. Thank you for listening and have a good day.